It has been over a year and a half since I first filed an access to information request to determine what talking points, if any, were given to unelected health bureaucrats speaking on behalf of Canadians at the World Health Organization's World Health Assembly in Geneva, Switzerland last year, wherein PSYOPs were discussed for achieving alleged health goals.
Behavioral science is now the first line of defense for our health system.
We have our own applications too that nudges people or reward them for healthy behaviors or giving them badges or these kind of rewards.
The Government of Canada is a strong proponent of behavioral science as part of an interdisciplinary approach to improve the health and well-being of all.
Do you remember how Canada's Chief Public Health Officer, Dr. Theresa Tam, blundered all the way through the pandemic response and then utilized state surveillance measures to track and trace Canadians' compliance with COVID-19 related public health measures? Well, I'm Tamara Ugolini with Rebel News, here to remind you of what these unelected bureaucrats discuss at globalist gatherings like the World Health Assembly, where delegates meet annually to discuss and decide on the policy agenda and strategies that best meets the World Health Organization's public health goals. The World Health Assembly is described by the globalist World Economic Forum as the decision-making body of the WHO, that's the World Health Organization, and the United Nations, UN's agency dedicated to promoting the global population's health and access to the highest levels of healthcare provision. All of the above alphabet agencies consist of unelected, unaccountable bureaucrats. And they say that the World Health Assembly is important because they have helped eradicate deadly diseases like smallpox and the once wild poliovirus, and helped foster international collaborations to develop and distribute vaccines for diseases like malaria and COVID-19. It's a big pharma-centric body dedicated to the big business of global health. Now, prior to the 75th World Health Assembly in May of 2022, I had reached out to Global Affairs Canada, asking them about which Canadian representatives would be there to delegate and if Canada would be putting forth proposals and/or amendments to the legally binding international health regulations. Global Affairs Canada confirmed that they received my request and they would apparently circle back, but they didn't. And even after I followed up requesting if there was an overseer from Global Affairs Canada that gives delegates their talking points, how these delegates are chosen, how many are elected versus appointed, and if transcripts will be made available of the globalist gathering where issues affecting Canadians will be discussed and or decided upon, finally asking why and or why not. And of course, no one followed up. This is why we had to file this ATIP, this Access to Information request, and thanks to your generous donations and support, we could do just that at rebelinvestigates.com. But before I show you the mediocre 5-page document that I received back 18 months later, here's a refresher of what Dr. Theresa Tam had to say at that assembly last year about behavior science for better health.
I think coming back to evaluation and science, I think it's important when applications are being stood up that there is an actual integrated evaluation and research aspect to them. Otherwise, you have no idea whether they work or they don't work. So maybe government can at least play a role in that space. We've certainly seen a growth of these applications, and we have our own applications too that nudges people or reward them for healthy behaviors or giving them badges or these kind of rewards. And I don't see people doing that research as much as we would like. So maybe I'll turn it back to chief science officers to see if they can help. But I think regulation of social media platforms is the one that governments have been really engaged in, and that's quite a massive piece of space of regulation that is still undergoing debate.
Now, the ATIP response garnered 5 pages of a document titled Strategic Overview Note Minister's Program and was specific to the proposed amendments to the legally binding existing international health regulations. The only real direction it appears to give is that there will be, quote, several opportunities to advance Canadian interests and objectives in relation to many of these matters, and those matters included a new pandemic treaty or accord, health financing, climate change, etc., over the course of the 2+ day program. Your program is designed to reinforce Canada's role as a constructive and active multilateral player, leader, and collaborative partner in global health, end quote. Canada's national statement includes reiterating the Assembly theme from last year, Health for Peace and Peace for Health, to include the Russian invasion of Ukraine and its horrible health consequences, to support a strong WHO, enhance global health security, and sustaining progress on health issues such as immunization, universal health coverage, mental health, and sexual and reproductive health and research. It looks like Canada participated in side events, notably the AMR, Antimicrobial Resistance Alliance of Champions Breakfast, which is described as a closed-door, ministers-only event hosted by Sweden and the United Kingdom, a Canada-sponsored event on immunization and links to pandemic prevention, preparedness, and response. The written remarks on Canada's delegation on the considerations of amendments to existing legally binding IHR, the health regulations, highlight the need for amendments that are limited in scope and aim to address specific and clearly identified issues, challenges, or gaps. But there was no mention of TAM at the Behavioral Science Roundtable or what actually happened with those amendments. As reported by independent researcher James Roguski, the amendments were adopted 3 days later on May 27, 2022. A central part of implementing this theory of One Health, global health, and universal public health measures is through a behavioral science lens that is otherwise known as a psychological operation, or quite simply, a PSYOP. At this year's 76th Assembly in May, during one of the many committee meetings, Director General for the WHO, that's Tedros Ghebreyesus, explains where the behavioral science idea originated from. Check it out.
A person who helped us start this as part of the transformation about the behavioral science. During my open door hours, Elena Altieri came up with a red book, which I still remember, very vivid actually, entitled Nudge, which was published by or written by Richard Teller and Cass Sunstein. And then she argued why for WHO introducing the idea of behavioral science is important. I would be happy, by the way, if you can stand up so they can see who Elena Altieri is. And then I was convinced, and then, of course, we went ahead to incubate it, agreed to incubate, and also established the first technical advisory group, which was chaired by the author of the Nudge. The first chair was Dr. Sunstein, and of course now the new chair is Dr. Susan. I think you can say it's better late than never. Otherwise, the importance of it you have already stressed. Of course, as many of you said, and also Jeremy stressed, it's not a silver bullet. We have to use a comprehensive approach. It's one which is very important, but it has to be used with other. And unless we have a comprehensive approach, the behavioral science alone will not give us the desired result. The other comment is with supporting regions. We have already started that. and we're ready also to support countries.
And at that same assembly, here is what Canada's delegate had to say about the topic of behaviour science.
Canada is pleased to co-sponsor the Behavioural Sciences for Better Health resolution. We thank Malaysia for their leadership on this resolution. The Government of Canada is a strong proponent of behavioural science as part of an interdisciplinary approach to improve the health and well-being of all. Canada recognizes the value of behavioural science in contributing to effective public health interventions. As such, the Public Health Agency of Canada, which is Canada's federal agency for public health, established a dedicated behavioural science office in 2021. Canada supports efforts to mainstream behavioural science approaches across the WHO and its member states and to enhance behavioural science practices in public health. We welcome efforts to establish a mechanism for compiling and disseminating behavioural science evidence and interventions that can be used by member states to further improve public health outcomes.
She thanks Malaysia for leading the way, but that's a little bit terrifying given that this is what their health minister had to say about his secret execution of behavioural science training during last year's assembly.
I want to start by echoing what DG Tedros said just now. The science was irrefutable as far as the vaccination was concerned. 90+% efficacy, safe, stable. But before I became health minister, I was science minister, as well as the coordinating minister for the national COVID-19 vaccination program. I knew what DG said was true, that the science alone would not be enough. So I went back to school. I took a massive open online course on behavioral insight for public policy decision making. Now my guys are mortified because they don't know this. They don't know that I was learning about this. And I learned about this because we could not take things for granted. We could not take the science for granted. We could not take people's behavior for granted. And you must remember, when we started the immunization program, a lot of people were already quite fatigued when it came to nudges and instructions. It had already been 1.5 years of telling them to mask up, isolate, wash their hands, physical distancing, so it was difficult. Now, alhamdulillah, we have 98% of our adult population fully vaccinated, 70% of the adult population boosted. So by no means Malaysia is an example for the world, but I wanted to share some insights briefly about what worked and what didn't work. But before that, I want to say one clear statement of intent, for us at least in Malaysia, that behavioral science is now the first line of defense for our health system. Because if you can get people to change the way they live, you will safeguard your healthcare system. And we saw behavioral insights play a big role in the pandemic. But I want to raise one important cautionary note. A pandemic or health crises or emergencies are outliers for mass behavioral change.
We knew then, but arguably no more now, that much of what he says is in fact refutable about 90% efficacy, safety, and stability of the novel injections. And his secrecy around training is deceptive at best, not the markers of democratic, transparent governance. Regardless, at least one organization opposed the indiscriminate implementation of behavior science, a delegate from the People's Health Movement of Medicus Mundi.
The report's recommendation focused disproportionately on assistive technologies. This can lead to the prioritization of market-driven interventions. Additional research should focus on the neglected issues of sexual and reproductive health of persons with disabilities. The resolution in EV 152/23 urged countries to allocate resources to mainstream behavioral science in public health. Why this should be the case while PHC services in many countries remain under-resourced is unclear. The resolution requests the General Director to compile and disseminate evidence on improved outcomes resulting from using behavioral sciences. Focusing only on improved outcomes creates a biased data set. The Secretariat should report on the impact of behavioral sciences interventions, whether positive or negative. The resolution contains no guidelines on regulatory frameworks that should govern use of personal data in behavioral interventions. This raises concerns about privacy, transparency, data ownership and management, particularly when public-private partnerships and for-profit companies are involved in designing behavioral interventions.
After all, a key part of the behavioral science tool is to address public health priorities, including vaccine hesitancy, misinformation, and disinformation that conflicts with public health-based evidence. For Rebel News, I'm Tamara Ugolini. The World Health Organization is aiming to strengthen its mandate by strengthening existing legally binding international health regulations to formalize their health power grip. If you have concerns that the health decisions of sovereign nations will be left in the hands of unelected and unaccountable bureaucrats and oligarchs, then please sign our petition at exposethewho.com. At that website, you can check out all of our previous reports on this subject and stay up to date as we conduct more coverage. That's exposethewho.com.